Hello and welcome to this edition of Bayou Time. I'm your host, Keith Whiteside, licensed clinical social worker with Terrebonne Home Care. Thank you so much for joining us. You know, we are proud of a lot of things that we have here in Terrebonne Parish and especially here in Houma, Louisiana. One of those things is our outstanding and excellent care when it comes to treating patients. One of those is our excellent cardiac care. And so one of the things that happens is that CIS, Cardiovascular Institute of the South, does a fantastic job at not only taking care of patients, but helping to train other people in about all of the things that are happening all over the world when it comes to cardiovascular health. And so they put on every year their new cardiovascular horizons, and this year it was held at the Roosevelt over in New Orleans. And our own Martin Foss was able to catch up with Dr. Craig Walker as he shared some of his thoughts about this particular conference and what's happening with cardiovascular disease.
All right, joining me now, Dr. Craig Walker, and of course, I've introduced him so many times, and he's the founder of this great cardiovascular. I'm gonna call it a learning seminar. So many things, it's a convention, but a lot of people learn. And how many years is this, Doc?
This is our 23rd year. It looks like it's going to be our biggest conference ever. It's exciting. We have experts from all over the world here. We have experts from all over the world that will be doing live cases, great attendance, a lot of fun. You can hear the music in the background now, but really wonderful sessions this morning with state-of-the-art knowledge about how to better treat patients and achieve better outcomes. This is really important. Also, we're addressing other things. How can we make care more personal? How can we make it easier for people to get in and out of systems? Because it is confusing. Medicine is that. And how can we communicate better to achieve the goals of better care?
I saw Dr. Donald Io, who was there when I was at Nichols, and of course, first thing he told me, he was listening to you speak just a little while ago, and he said, what an excellent speaker. And he said, we talked a little bit, and just to see people like Dr. Io and other people come through here, and over the years, you have had the who's who here in New Orleans, and not only is it a testament to medicine, it's a testament to business. The shot in the arm that this does for this area is incredible.
I think it is, and certainly the practice we've built in Houma has been a big shot to Houma and our region with patients coming from all over the world. Those people come to Houma, they buy cars in Houma, they go out to eat. These patients come not just from our state, not just from neighboring states, they come from many other countries as well. It's incredible what that has meant. But getting back to Dr. Io, he was Dean of Health Sciences when I was at Nichols. Wonderful man, was certainly a great mentor to me. He helped me in my career as I got started. And I would say he's a wonderful ambassador for our part of the world. When I first moved back from Harvard, he was the first to call and welcome me back. He said, Craig, let me introduce you to people on the bayou, and he did. Right. And he made that extra effort that I wonder, would that have ever happened at any other university? Right. But he did this, and really I can never forget that. And frankly, I can never forget the fact that although I commuted to Nichols every day from below Berg, which was almost an hour commute every day, right. I enjoyed my time there. I had good instructors, it was personal, it took a young man and helped make me a man, and it prepared me for medical school, and certainly I was able to finish as a very young doctor.
You mentioned the word ambassador, and that fits Dr. Io well, but I was telling Bevy when we were talking before, I said, Dr. Walker's become such a mentor, and with the fellows, and all of the learning that people have learned from what y'all have done in Houma. Mentor would be a good word, but ambassador would fit you well too, wouldn't it?
Well, I hope, and my goal is to improve care. I don't want to see anyone ever have an amputation that doesn't need it. I don't want to see someone keep a venous ulcer for 30 years that can be treated sometimes in 5 minutes and heal sometimes in as short as a month. I don't want to see care that could be better not become better because of lack of knowledge or lack of exposure. And that's what this is about. Assembling the greatest minds in the field that do this, those with the greatest expertise, And frankly, Martin, it's fun because when I come here in teaching, I'm also learning. I'm learning from these other people, side conversations, we share new ideas, we come up with things that will improve care, and we've seen that care manifest by outcomes data for the Houma region. We have seen in the Houma region what was many, many years ago one of the highest amputations in the rates in the United States become the lowest. We've seen an area that had one of the highest cardiovascular deaths, made it one of the lowest. This is very important to us in our area because without health, we have nothing at all.
And I want to start the count. We've got a couple of minutes left in this segment, and I'm going to come back and we're going to talk more about venous, because when you first started your practice, and I was interviewing you as a young reporter and a young doctor, frankly, venous was on the map, but it really wasn't on the map like it is now. You have come so far, and I guess the knowledge that y'all have learned and taught over the years has really changed medicine. It's changed people's health across the world, and that is an unbelievable task y'all took on, but it has saved many lives.
It sure has, and saved many legs. You know, I must tell you, Martin, vein disease is even more common than arterial disease, as you and I have talked. Well, what was the difference in the past? We didn't have the treatments we needed to be able to improve outcomes with it. There's been great strides made with this, and many of those strides came from CIS. We helped to develop some of the new techniques. We helped to develop some of the new treatments and how they were employed to improve those outcomes. I'm very proud of what my group has done. You know, we're a group now of 85 cardiologists, not just in Houma, but throughout CIS. That makes us one of the biggest groups anywhere in the world. If you look at publication rates, one of the most published groups in the world. If you look at academic appointments, many academic appointments at major medical schools, I'm very proud of my group and what they have become, because they have joined in that same vision of improving care for our patients, but improving care throughout the world.
We have so much film from way back, the open heart surgeries, the stents, the trial runs, the balloons. Now as we see you build a new facility in Gray, when you walk in it, it's sort of like the old Jetsons. When you watch the Jetsons, you go, how are they ever going to get to that point? We're there. The technology is unbelievable what y'all have done.
It is. It is meant to be a step into the future. It's the best equipment made. It's a comfortable setting for patients. It's easy in, easy out. Because, you know, Martin, all too often people don't even get health care because they find it too difficult to get it. This was my attempt at making it easier, making it more affordable, and yet having the very best equipment. It was always my dream that I wanted a facility where the only limitation I had was my own limitations, nothing else. None of us are perfect and none of us can do everything, but I'm surrounded by incredible help, incredible equipment in a world-class facility where really the only excuse for failure is me. It's not anything else, and I think that's so important. It has made my life really very exciting, and I think, frankly, it's extended my career because I am very happy with what I'm doing. I can palpably feel how much patients enjoy being treated there.
Well, let me say this, because you make a great point. I thoroughly believe that you have found another way to love what you do. And it's obvious because the results you get from the venous procedures that you do, it's got to make you go, the smiles on people's faces just make you want to keep going.
It does. All of my career in medicine, I wanted to be a good doctor. I really devoted my whole life to reading, to learning, to thinking about new things, new tools, and it's really been a wonderful thing that's happened. I love what I do. I have people all the time ask me, when am I going to retire? And I honestly tell them, I've never thought about it. And so then they sometimes ask my wife, when is he going to retire? She says he's never thought about it. And they said, well, what do you think about that? She says, I love the fact that he's so passionate about what he does. He enjoys it, he's making a difference, and I'm going to support him in that effort. It's a wonderful thing because my family is behind my efforts. And Martin, as I said before, if my skill set starts to slip, I'll move on. But as long as I can do what I do, I frankly love treating patients. It's my passion.
As this room is filling up, and I remember the old days when you were coming out with procedures and y'all were doing the trial runs on things. And people had to not only buy into the procedure, they had to believe in you and believe what y'all were teaching them was the way to go. It was the way to go by looking at this crowd.
Well, it's interesting. I was then called a maverick. Now I'm called the Godfather. It's a very different set of ideas. But the young people who have come up the field have read what we did, have followed our actions, and truthfully now refer to me in the meetings as the Godfather in this field.
Well, it's not a bad name in the medical field, is it?
No, it's not. It has a different connotation.
But once again, and I like to always bring this up, that people from all over the world are gathering in New Orleans to come and hear and see a guy from Houma, Louisiana, who could have went anywhere in the world after you went to Harvard. You could have went anywhere. You chose to come back to Houma.
I went where I wanted to be. It was always my dream to come back. It's interesting. Several of my Harvard fellow classmates are here today. They've come from all over, and it's really a wonderful thing. We have, I think, made a mark in Houma. More important for me, I brought back something to my community. I think I was able to give back something. To me, that means a lot, Martin. It was a mission in my life. And my biggest regret is I don't have my parents here to see it.
Right. Well, who knows? I think they are seeing it for sure.
I hope so too.
And you've done a fantastic job. And while the good doc is up here, once again, look, he always gets big talent. These are Grammy nominated. They play Cajun Zydeco. You switched it up a little bit this year.
Always.
Yeah, you always got to keep people on a fresh start. Congratulations on your career. Congratulations for what you do. And man, I'm so proud of you, interviewing you all these years. And it just seems like the roads never end, and you're always trying new things that work.
Thank you, Martin. You've been a real ambassador for our community. You are a spokesperson for the Houma Thibodaux area, and I appreciate what you do.
Thank you, Don. All right, Dr. Craig Walker, once again, and doing a great job here in New Orleans, not to mention the economic impact of this. Don't forget that, folks. It's all about medicine, but it's all about the economy, and it's done a great job. We'll take a short break. We'll be right back.